of the Capital Committee meeting held on June 13, 2022. I will poll each member individually. Jose?
Yes.
Dr. Katz?
Yes.
Frida? Bob?
Yes.
Thank you. The motion is carried. Next, we will have the Senior Assistant Vice President report. Mr.
Sorry,
Sally?
Sally, I just joined you. I vote yes.
Oh, Sally. Okay.
Okay.
Sally,
Yes.
your vote? Yes. Thank you. Thank you, Sally. So now next, we will have the Senior Assistant Vice President report. Mr. Salas?
Good morning, everyone, members of the board, the chair, Mr. Peñacora, and Dr. Katz. Our fiscal year for 2022 has concluded, and I would like to take this opportunity to highlight some of our key accomplishments from the team this past year. On the operations front, our engineers and tradesmen strive consistently to support and serve the daily operations of our facilities. Bellevue was challenged to keep up its critical oxygen systems available throughout the campus after experiencing a substantial vaporizer failure. Our in-house team acted swiftly to keep the system from freezing, allowing flow of oxygen to continue throughout the campus, maintaining services for our patients. The cooling system at Bellevue, for the first time in over a decade, will be in full operation of all of its chillers and cooling tower cells, thanks to the strategic actions taken by our in-house team and OFD, thus providing sufficient cooling to the campus. Kings County, earlier in the winter, our in-house engineers were a very talented group of individuals acted swiftly over the winter to prevent the loss of our main water feed lines by providing urgent repairs and replacement of critical water lines, bypass direct feeds to stabilize our heating systems for over 300 million feet of square campus, 300 million square feet of campus space. Harlem Hospital also experienced a dire emergency when a major rupture from a condensate line that fed the cooling towers to the main hospital had a major impact on our cooling system. After the incredible work of our in-house team, along with every division of OFD and senior administration, temp systems were installed to stabilize the cooling system, and after a considerable amount of repair, we are now fully operational, thus removing the dependency of our temp systems, which have fully been demobilized and removed from the campus. Finally, over the course of this past year, we have been able to conduct monthly joint review meetings with each of our service partners and DOE team to review service opportunities and KPIs, thus allowing our partnerships to focus on strategic outcomes. On the capital front of our division, there have been tremendous efforts in partnership with our colleagues in finance. Our budget and payments have facilitated the commitment of over $575 million in capital contracts, which provided a 22% increase in dollar value compared to last year, represented over 1,000 purchase orders. Our payments team processed a high volume of payments supporting the system and saw a 22% increase in transactions from over 2,000 to 2,500 vouchers. Our budget team was able to authorize 122 projects valued at $474 million, a 47% increase in both the number of projects authorized and dollars compared to last year. Relative to contracts, $425 million is in city capital, and our infrastructure commitment rate was 80%. Our contract team bid on over 50 projects totaling $221 million. The average number of bids received per project was 5, and the winning bidders' proposals were on an average of 4% below the estimates. Of the 242 total bids received, 38% were minority and women-owned businesses, and 41% of the 50 awarded contracts were MWBE. 234 work orders were issued for requirements contractors totaling $42.3 million, and 130 work orders were issued for jocks totaling $23.1 million. Some additional team accomplishments include the transition of our centers of excellence to our in-house team, as well as demobilizing our temp clinics. Our 50 water office consolidation project is complete. Construction continues on Bellevue OTXU projects, and the Woodhall decanting project is underway for construction to begin on the OTXU project at the site in the winter of 2022. We expect to release our RFP at the end of the month for a pool of vendors to provide master planning services for the system, which we expect to better inform our capital strategy, to better align with systems missions and strategy to create equitable modern care environments for our patients and staff that meet the needs of our community. Harlem Boiler Project replacement and Metropolitan Flood Wall are moving forward. Our energy and carbon reduction efforts continue system-wide. This year, we signed a pledge with the federal government to reduce emissions by 50% in all of our facilities by 2030 and work towards zero emissions by 2050. We continue to retrofit, refurbish, and modernize outdated equipment, fixtures, and utilities to reach this goal, and are looking forward to working on innovative projects to reduce our greenhouse emissions and ensure all of our facilities are resilient. In this upcoming year, we are working on restarting our Facilities Council. The implementation of Phase 1 of our Project Management Information System is scheduled to begin in September 2022. This would allow our new needs process to be completed in Kahlua, which is the name of the system. We are still in the process of evaluating our facilities management system, and I look forward to the exciting work we have coming up in this next fiscal year, and I want to thank our entire energetic and passionate team for accomplishing such transformative work. I am happy to take any questions.
Thank you, Mr. Saez. We really appreciate it for such a comprehensive report. A lot of things. So definitely you have been very, very busy. Even though you have lost some key members of your organizations, you continue to push forward and set up the process and set the systems for success. So thank you so much for your report, and I would like to poll each member of the committee if they have any questions or comments. Jose?
No questions, and I totally agree with everything you said. Thank you for a great report.
Thank you.
Jose. Dr. Katz? You are muted, Dr. Katz. We cannot hear.
Thanks, Vinny. Just for a little humor, we call them MOM, the leadership group, Manny, Oscar, and Menji. And we all know what moms can do.
Yes.
And so I really commend them on how well they have pulled together, as a team to, deal with our issues. And certainly Manny knows, along with Oscar, that my major push to them is hire, right? We got to hire more people because we have been benefited from a lot of capital dollars that have been given to us as a reward, because people saw in COVID the amazing work that health and hospitals can do. Unfortunately, the team has to catch up from decades of lack of infrastructure. And that's, when you listen to Manny's report, it's all about things that should have been fixed 20 years ago, 30 years ago, systems where sometimes Manny can't even get the spare part anymore because they don't make it. And our facility people are amazing heroes who hold our buildings together with Scotch tape and rubber bands, and the occasional visit at 11 p.m., to Home Depot, to pick up something. This is not, Manny's laughing because he was the one who went to the Home Depot. Right, I mean, this is the reality of what we're doing. And so now we have some money, but of course the money is no good in the bank, right? The purpose is to, as rapidly as possible, handle all of these projects, and there's no way that even Mom can do it, with her current resources. So we want them to hire up and to, be able to deliver all of what we know they can do. Thank you, Mr. Chair.
Yeah, thank you, Dr. Katz. And I do agree. I have worked, well, we all have worked very closely with the group, and we have seen how they have raised to the occasion, and they have doing like 150% to make sure that the services are there for our patients and our staff when the infrastructure fails. So I agree with everything you say. And in this labor market, it's difficult to find, but definitely I think we have a very good value proposition. The work that any person that comes and work in this group of capital will have a significant impact. And I think this is something that will be appealing to quite a few professionals to have a mark and leave a mark. So thank you for your support, Dr. Katz, the group.
Thank you.
And Frida, comments, questions?
No, I can't add any, but to what was just said. But I just also want to thank the team and keep the moms going.
Thank you. But they also have a dad in Dr. Katz. So, Bob,
I have no questions at this time. Thank you for the presentation.
thank you. Sally?
Manny, if we could have a copy of your report, there was just so much information. It's hard to digest so quickly, but it'd be useful to be able to read it. That's all.
Absolutely. We'll certainly provide it. Thank you.
Thank you.
Sally. And Manny, I know that, based on our conversations earlier, I really want to thank the group and the support of Dr. Katz and everybody on looking at the master plan, because as you get a lot of money, you wanted to spend it strategically and wise. And I think the master planning is critical to understand how the different pieces of the systems work together. And I noticed that you use equitable as one of the adjectives in the master plan. And even though you didn't use the word sustainably, in the when describing the master plan, in your second statement after the master plan, you mentioned your pledge to the federal government in terms of looking at energy reduction. But I hope that as you are looking at the master plan, you're looking not only at energy, but any of the resources that we use, how to ensure that we are using those natural resources responsibly, and we are not adding to the taxing of our environment, like, for example, waste reduction, water consumption, and all the different strategies that we have to use natural resources the best way possible to ensure that the system is contributing to reduce any harm to our environment.
Thank you.
Um, yeah, so in that case, thank you for your presentation. And now we have a resolution with Martha Vincent, Mr. Gonzalez. So is the one presenter or is Leora? I see a presentation of Leora, but
Yes, hi Vinyasky. This is Leora and Michelle Lewis, and we're here to present the renewal of the lease at Ondurondeck Avenue for the use by Gotham Health. First, I will read the resolution, and then Michelle and I will go over the background and lease terms, and of course, take any questions. We are here to request authorization for New York City Health and Hospitals Corporation to sign a 5-year lease extension with Martha Vincent for the continued use of approximately 2,078 square feet of space at 769 Ondurondeck Avenue in the borough of Queens to operate a primary care program managed by New York City Hospitals at Gotham Health at a base rent of $69,000 per year or $33.21 per square foot to be escalated by 3% per year for a total of $366,330.37 over the 5-year initial term, plus a charge for the proportionate share of real estate taxes over the 2012-2013 base year, provided the system will hold an option to renew the lease for an additional 5 years, resulting in a base rent over the potential 10-year term of $791,007.67 and an estimated $50,469.73 for the tax escalation charges, for an estimated total rent over the 10-year term of $841,477.40. I'm going to turn it over to my colleague, Michelle Lewis, who's really going to talk about the program and really the core of what goes on at Ondurondeck Avenue. Michelle.
Good morning. My name is Michelle Lewis. I'm the CEO for Gotham Health. I'm here to speak on the importance of Gotham Health Ridgewood Health Center. New York City Health and Hospitals has operated a primary care program at Ondurondeck Avenue since 1994, when we assumed management from New York City Department of Health and Mental Hygiene. Since its formation in 2015, Gotham Health Ridgewood has been among the sites for which Gotham Health shares governance authority with H&H. Ridgewood currently serves approximately 3,500 patients and covers 10 zip codes in the Brooklyn, Queens neighborhoods. Ridgewood currently provides pediatrics and adolescent services. Within that catchment area served by the health center, there are over 200,000 low-income residents not currently served by health centers to address their needs. We are currently developing plans to expand services to include adult primary care, which will address the high obesity and high blood pressure, which are the main health disparities in the community, and also adding women's health and behavioral health, which our patient survey results shows a very high need. This health center has been an important fixture in the community and continue to strive to meet the health needs of the patients we serve on a daily basis. There is a great amount of potential for growth, and we are working around the clock to ensure that we deliver the best care possible to our patients. Thank you.
Some photos of the interior of the clinic. And now I'll just quickly run over the lease terms. The resolution requests the lease renewal, as I said, for 2,078 square feet for ground floor space. The base rent is $33.21 per square foot, which is a 3.7% increase above the current rent of $32 per square foot. The 5-year initial term commences October 1st of this year and ends September 30th, 2027. We will have a renewal option for 5 years after that. The annual rent increases will be at 3%, plus our share of the real estate taxes increase above the 2012-2013 base year, estimated to be approximately $23,373.47 over the 5-year initial term, and an additional $27,096.26 for the 5-year option. And that will be clearer when we go to the next slide. The occupancy cost for the 5-year term, including the real estate increases, will total $389,703.84, and over the 5-year option with the real estate increases, $451,773.56. The rent is in the range of a fair market value. The next slide is the math behind the many numbers I just spoke of. That concludes the presentation. Should there be any questions, we'd be happy to answer.
Thank you, Leora, and thank you for the presentation. And I just wanted to give everyone the opportunity to ask questions. So, Jose?
I have no questions. Thank you.
Dr. Katz? You're muted, Dr. Katz.
I have no questions. Thank you.
Thank you. Frida?
I have a couple of questions for the presentation. I'm curious about the lease escalation amounts in the prior lease, because it seems the rent is very much in the ballpark based on the valuation of the comps, but the consultant did reference that the lease escalation is a little bit on the high side. So was this just was the prior lease, did that contain a 3% annual increase before too?
Yeah, so this is just a continuation of the relationship. So we're certainly not leaving, and this is a good partner, and it's a modest increase, and it does realign and match. There were a lot of ranges in that fair market valuation, as you saw, Frida, and so this fits squarely in the middle. I believe the low end was at 24 and the high end was at 40. So when you look at the real estate and the base rent on this, I think combined maybe 35. So we're right in the sweet spot. So we felt comfortable.
Yeah, I agree. I think the comps definitely put us right in the sweet spot. It was just that he had noted that the escalation was on the higher side, meaning the annual, I believe, the 3% going forward. So I was wondering if that's what was in the original lease. How long have we been in this space?
Since 1994.
So it's been with this landlord since 94.
3% has been typical, but we're happy to go back and we can go back and check the original lease. I think it's 3% on the previous escalation. So,
right. Okay. The taxes. Why are the taxes just since 2012?
I think
we're just taking the increase.
Yeah, I think there are two ways to do this, right? You can that will get us to the same number. So we could reset the entire rent and have 0 taxes, right? Or you keep the current rent, do the escalation, you take a pro rata portion of the increase of the taxes. But in the end, the total number gets you to the market condition. And since we've been a long time tenant there, we didn't reset.
I see. So the prior lease probably was in 2012. It was a
correct.
10-year lease originally, right?
So we could have reset it at $35 per square foot with 0 taxes and then go up incrementally, or we could do what we did because we've been there a long time and just take an increase off the current rent and then show the escalation on the real estate taxes.
Right. And that's fine. I mean, then we were actually, the taxes become more of a pass through. Maybe those increase at a different rate, et cetera. So that makes sense. And this is something we'd talked about a long time ago, probably Leora, before you started. And that was taking a look at kind of the whole, and Fanny, I don't know if you remember this, the whole lease portfolio, because there's lots of different leases that come before us. Some we pay tax, paid taxes. What was the what's the rationale? We're a non-taxing entity. Is there an ability to pass through? Is there an ability to pass through our tax exemption, and so that there aren't any? And so it would be helpful, I think, to try to. I think we kind of dropped that. COVID came along, and we had a lot of other priorities, and so. But maybe it would be helpful, Fenny, to go back and just get a more comprehensive look at how we manage all of these various leases we have, and in terms, and how we consider negotiations, et cetera.
I agree, Frida, and I think that's something that we have brought. I know that there was also some leases that we pay utilities and others we do not pay utilities. I think there is just a combination of that. And I think now as we are embarking, as Manny said, in master planning, so maybe we can look also at the master lease agreement that we can think of, even though each location has different and the history and the legacy contracting. So there is a lot of moving pieces, but definitely for any new leases, we should have like kind of standards that we feel that really puts us in the best position.
Yeah.
So I really agree. And that brings me to Leora. Okay, actually, let me go through the list and I will ask my question at the end. Bob, any questions?
No, thank you very much.
Thank you. Sally, any questions or comments?
I just want to say that Gotham is just a giant resource for us. Your clinics are amazing. And I just want to point out that in 2,000 square feet, they've seen almost 6,500 patients. So in what is really a very modest amount of space, they provide such a high level of service. So congratulations, Michelle.
Thank you.
Thank you. And so I have a couple of questions, Leora and Michelle. One is in terms of the lease, I believe this one includes utility, or do we have to pay utilities separately in this space?
I can't remember. Diane, do you recall? The utilities are separate. I apologize. I didn't have that handy, Finyaski. The utilities are additional.
Are additional.
Yes.
So, okay. I think in some other leases that we have, when the utilities are additional, they are presented as well as part of the information. But again, as Frida said, we figured out how to present a more standardized way of the leases. My second question is, if we go back to the photographs, and I know that I have had these discussions with Dr. Long and some of you, can you go to the first one? What I said is like, I'm echoing Sally's comment, the service that is provided. I know that before the pandemic, Sally, Jose, Frida, and I visit several Gotham's facilities. And again, you could see how the patients are very appreciative and thankful of the services that they receive and the quality of the services. But I believe that also it's important to have a space that is very welcoming to everyone. And if you see that entrance there, even with the ironworks, again, it's not as appealing, even though I want to congratulate you on the signage and and the color scheme that make it more vibrant, more welcoming. But I was wondering, as we again look at leasing and renewing leases, if we also think on how to uh, invest somehow in the spaces to make it as welcoming as possible. We know, like for example, other systems with the urgent care, they make those spaces very welcoming, and we want to ensure that our patients feel as welcoming as well in our facilities. I just want to make that comment. I know that I have had these discussions before, but I just wanted to encourage all of you to think about that in order to not only have great services, but also in the most welcoming spaces. So with that, I would like to ask for a vote. If you can go back to the resolution slide. Jose,
Yes.
Dr. Katz,
Yes.
Frida,
Yes.
Bob,
Yes.
Sally,
Yes.
Peniowski also yes. The resolution, the motion carry, and we are going to forward it to the full board. Thank you. So we have a second resolution. I think is Oscar that's going to present it, or
No, this is Manny Saez. I'll read off the resolution and hand it over to Erin, who will walk us through the presentation. So in 2018,
Manny,
I'm sorry. Sorry.
Manny, before you start, if you're going to read the resolution, can we go to the last slide so that we can follow? Sometimes when the resolutions are long, it's difficult to keep up. Okay.
So this is a request for authorizing New York City Health and Hospitals Corporation to execute a contract with Gemco Electric Contractors, Inc. to complete an upgrade of the emergency electrical services Type 1 at New York City Health and Hospitals Elmhurst for a term to equal the duration of the proposed construction project for the amount, including a contingency of $1.2 million, $58,472, not to exceed $7,550,830. So in 2018, CMS cited Elmhurst for its electrical services not meeting National Fire Protection Association standards because it does not separate the service into three branches: critical for medical equipment and patient rooms, life safety for exit lighting and emergency lighting, and third, equipment for boilers, vacuum pumps, medical pumps, HVAC, etc. CMS gave the system a time-limited waiver of such citation has expired, with a further extension now being sought, thereby making it urgent that the system upgrade Elmhurst Electrical Systems. Under the proposed contract, work is projected to start approximately September 2022. So on the program background, the EES Type 1 is the emergency electrical system that provides the separation of emergency power into three distributed branches: critical, life safety, and equipment. The current state of Elmer's existing system does not meet the current National Safety Protection Association codes and must be upgraded as required by the New York State DOH and CMS in order to comply with the NFPA requirement for critical branch separation. New York City Health and Hospitals Elmhurst was cited by CMS in March of 2018 and was granted a time-limited waiver by the New York State Department of Health in July 2018, which expired July 1st, 2021. Facility has been working on the extension with DOH since prior of the expiration. The ESS Type 1 project will take 2 years to bring the system up to code by running three branches to support the emergency power throughout the facility. With that, I'd like to hand it over to Erin Egan, who will take us through the rest of the presentation.
Thank you. So this project did go out to RFP on the city record. In mid-March, we had the mandatory site walkthroughs. 8 vendors attended. Mid-April, the sealed bids had come in and been reviewed. We had received 3 proposals from those walkthroughs. And then on May 10th, we had the pre-qualification meeting with the lowest bidder, and that was Gemco Electric. Next slide, please. So Gemco, as stated, was the lowest bidder, and they have an MWBE of 31.76 for subcontractor utilization plan. And the contract amount is $6,292,358. Gemco is currently one of our JOX contractors, and that is from the 2020 to 2022 period. And they were also a JOX contractor from 2018 to 2020. Evaluations for both contracts were rated at 93%, respectively. Additionally, the ratings listed in MOX include 2 excellent and 4 good. This project is expected to begin fall of 2022, and it will last about 2 years with a completion expected in fall of 2024. Next slide, please. So this shows the evaluations. They came in at a good, satisfactory rating. Next slide, please. So we're asking for a 20% project contingency of $1,258,472 for a total not to exceed of $7,550,830. Some of the reasons that we're asking for the higher contingency is the difficulties of unforeseen field conditions. Elmhurst is a very old hospital, and this is a very antiquated system. Also, we have seen, even from when we did the cost estimate to when the actual bids came in, there has been a spike in prices, and that is due to supply chain issues and the cost of commodities increasing. Next slide, please. So we are requesting Elmhurst Hospital for a term equal the duration of the proposed construction project for an amount including a contingency of the $1,258,472 for the not to exceed of $7,550,830. I'd be happy to answer any questions.
Benny, you're on mute.
Sorry, there was a sound and I thought it was coming from my house. But anyway, thank you for letting me know. I will ask now for questions from the members. Jose?
I have no questions. Thank you.
Dr. Katz?
No questions, thank you.
Frida?
Hi, I do have a couple of questions. Thank you for the presentation. One is just some background on the citation. I noted it was in 2018. We got a waiver through 2021, and I see we're working on an extension. Just, are there any ramifications that it's taken some time? You know, what's the rationale for just taking the contract up now? And is there any risk of, you know, the extension not being coterminous with the term of our expected construction period?
Well, I could speak to partially why it's taken so long. Vendors did not want to enter the building during COVID to do the cost estimates. So I hate to say it, but COVID delayed us a bit here on this. In regards to the waiver, I know that the facilities has been working with the various departments to get another extension, obviously citing COVID for a large part of the delay. They are actively working on it. The problem that they are facing is the various departments are saying that they need to go to a different department to get the extension. Then they go to that department, and then they're saying you have to go back to the original department. So there's a little bit of back and forth with the actual second extension.
Frida, it's Menji. I'll just add to what Erin's saying. So when she says department, she means DOH.
Right.
So the facility actually has started work prior to the expiration of the last waiver to try and extend it so it could align with the expiration and they could have a continuous waiver. However, the stance DOH is taking is that once the waiver expires, for us to get an extension of the waiver or another waiver, we'd have to be cited.
That's correct.
So we'd have to be cited by Joint Commission or CMS before they grant us another waiver. That's their stance, and we've pushed back and we've said that really makes no sense because We're doing the work. We have a plan. We're just asking for more time for the waiver to allow us, in case a regulatory body comes on site, to be able to show them that we have this waiver, we have a plan, we're remedying it. But they've been firm on the fact that for them to give us another waiver, Joint Commissioner CMS would have to cite us before they grant us the waiver.
Right. Okay. So, I mean, I guess we're moving forward. There isn't any other kind of fines or penalties that we're incurring in this
No.
process with the waiver expired and, okay, and the work's still not being done. So I think it sounds like it's more just a process that sequentially, but we're moving forward, and there's a risk perhaps we get cited again and then we get the waiver, but we're going to get.
Correct. And I think if Joint Commissioner CMS
expeditiously.
were to come on site and cite us by showing that we have a contract, we have a plan, we're
Right.
moving forward, that would probably, you know, and it really depends on the surveyor, but that would probably reduce the severity of the citation. That we're
Okay.
actively working to remedy the situation.
Got it. Thank you. That's very helpful. And then I did have another question on the contingency, and I think it makes sense that we have a sizable contingency here, given the reasons you cited, and obviously everybody's experiencing the increases in pricing that we've got. The contract amount that we've agreed upon, is that not to how do increases at this point get passed through to us?
So there would be a PO issued for this construction value of $6,292,000. If there were change orders resulting from unforeseen conditions or material costs, that PO can then be amended within 10% of its value to increase to add. So if we'd have to go beyond 10%, we would have to probably issue an additional PO to cover anything beyond 10%. Our policy allows us to increase a PO by 10%. Beyond that, we'd have to issue another PO for any other contingencies needed. Does that answer your question?
So those change orders would be, I mean, clearly if there's different site conditions and things that we weren't anticipating, but if it's simply increase in cost in materials, that's eligible for a change order to increase cost?
The vendor would have to, you know, so we have a PO issued for this amount. If the vendor anticipates going above that amount, they'd have to alert us. And we have, within our procurement rules, we can increase the PO by 10% for this particular reason, to cover increase in materials, increase in costs that, you know, were unplanned. So if it was material costs, we would increase the PO within 10%. If it's an unforeseen condition or a site condition, we'd have to do a change order, if that makes sense.
I see. So the bid is not like a guaranteed maximum bid type of contract. I'm sorry, I don't know all the details of how those.
Frida, if you allow me, I think your question is a very important one, and maybe I also got a little bit confused. I thought that this bid was a hard bid. That means that they take the risk of the cost associated with delivering this. So are we indexing the cost so that if there is higher than that index, we will pay? How was this contract? I think that's what Frida is asking.
And I'm sorry if I wasn't, I'm sorry, maybe I wasn't clear in the explanation. You're right, Fanny, this was a hard bid. This is the number they've guaranteed. However, if they come into unforeseen conditions, you know, or if they have higher material costs than expected, they'll come back to the facility and say, hey, listen, this is what we proposed. Go ahead, Fanny, sorry.
I think this is a two parts, Menji.
Right.
This is a two part. The first part is unforeseen condition. We understand that,
Yep.
and that's why contingency covered. But higher cost, that is on their heartbeat contractor. They should have taken that risk unless we index it. And that's why we are not understanding. When you say that higher cost, are we taking that risk or are they taking that risk?
So if I could jump in, this is industry standard to do contingency on all construction contracts. Even in my previous life, we would always have a contingency because there is, aside from unforeseen risks, there is, especially now, volatility in the market. Even recently, we had a contract for an air handling unit, and it takes us about 6 to 9 months to go from the actual bid to getting into construction. That price changed. It changed dramatically. to the point where it wouldn't make sense for the contractor to do it. Like the cost differential was so huge. So we had to go into contingency because that is the actual price of the unit at the time. So when we went to the cost estimate last year in August of 21, to when we got the bids back, there was a 22% increase because that's how much the commodities have raised. So it is a hard bid. They did do what's called a bid breakout, where they see how much wiring they need, how much conduit, all these things, and they put a price next to it. But to Menji's point, if when we go to construction in the fall and there is a major swing in those prices, then it doesn't behoove the contractor to lose money on the job. So we then have to get backup. We review the backup, we review the commodities differences, and then we decide if it's warranted or not. There is always some price differential, but we're just seeing now the price differentials are huge. So we have to do this project. It's kind of like we don't have a choice, and the timing right now is a little tough with the supply chain issues. So that's partially what it is.
Benny, to your point, it's a hard bid, but sometimes our internal processes drag out the contract execution beyond the timeline for the bid price to hold. So when that passes, because of a criticality of a project, if it's like this project that we need to make sure it's in place, we don't want to go back out, get a new bid, because that could further delay it. It will be a change order the vendor submits and asks for an increase in their contract to allow for increase in prices of materials, if that makes sense.
I think we need to maybe, I don't know, we have to ask Alicia how we will answer these questions, because I do understand the contingency. That's not what I think Frida was asking.
No.
I think where we are having some challenges is in the way that the contract was set up for increasing prices. And I think you have different rationales here. The one that you mentioned, Menji, makes a lot of sense. That means if we delay the project and that goes beyond of their plan, and we bear some responsibility. And so the contract, it seems to have a clause that allows for increase in prices if it is due to our delay. But if there is a delay, that is their risk.
Correct.
So I think
Correct. Yes.
I think there are a lot of different explanations here that are not consistent. So I don't know, Colisha, how do we do this? I think this has to be answered before the board, and we need to understand how is this happening.
This is Calicia. We are authorizing the 7.5, including the 20% contingency. If there are instances where there are increase in cost that goes beyond the 7.5, the capital committee would come back to the board and ask for an increase in that NTE if it to accommodate that increase.
I understand, Colisha, that. I
Benny
think
has a different.
I don't want to speak for you, but I think the question is the contract, the ways that established to allow for price increase. I think that is the question.
So let me try.
And I think
sorry,
we
Fanny.
Can
I try
maybe
one more
time? What I was trying to do is like we are really behind time. So what I was thinking, we can approve it conditionally that you answer satisfactorily these questions, because I think Frida has a question, I have the question, and you need to show the contract and how you are managing and indexing price increases. Is that okay, Colisha, if we do that?
We can do the contingent approval so that at the board we will have the explanation.
Okay. Jose, you have a question?
Quick. I mean, it sounds like these are details that go into the contract that are important, of course, because it's like how you write the contract. So I was thinking that having an explanation of how that gets incorporated, or making a recommendation that this should be included in some way, it's important.
I agree.
Just a friendly amendment to the language of conditional. Because it sounds to me like it has to be like, if I'm going to do something for you and I put a bid for a price that I know I'm going to start in 6 months, and then I cannot change that number, right? I bear that risk. But if it takes 9 months, then somebody else bears that risk.
Yeah. I think that's what I think. Frida, is that what you were asking? I'm sorry, I just...
Yes, thank you.
So in that case, let's do that. But we have 2 more people that is Bob. Any question, any comments?
None, you've covered everything. Thanks so much.
Sally, any question or comments? You're muted, Sally.
Very quickly, this has taken some time since you were originally cited. I guess it's because it wasn't emergent or there were other capital needs that were more pressing. You know, when you hear about electrical work, you get a little uncomfortable because it sounds like it could be an emergent condition, but I guess in this case it wasn't.
Maybe I can answer this one just as a comparison. The way I would think about this, Sally, is that when this was created, this was the standard.
Right.
This is no longer considered the standard. So
Okay.
a lot of facilities across the country, including ones I've had in other cities, have the same problem, that they were not built with the separation, but now it's seen as the right thing to do. So
Okay.
I don't want any, it's not like it's a dangerous condition or it was built incorrectly. It's an improvement in how people see these systems. And it's mostly to try to ensure that in a disaster, you don't lose all of your systems at once, right? The more you segment systems, the more likely you are to be able to maintain some of them in a disaster.
Okay. Thank you very much, Mitch. That's it.
Thank you, Sally. Again, I just want to bring a couple of things in the resolution. We let's if it's possible, let's add that we are doing a 20% contingency because this is higher than we normally do. So if we do it right there, I think it will be clear to everybody. The other part is that we would like to have these questions answered in terms of the contract and the escalation of price and how that is being handled. I think that if it is okay, we can vote conditionally in getting that response before the board meeting. Is that okay with everybody? So
Yes.
let me in that case ask for everybody's vote. Jose?
Yes.
Dr. Katz?
Yes.
Frida?
Yes.
Bob?
Yes.
Sally?
Yes.
Feniowski also vote yes. I also wanted, before we are at the end, but there was a comment, and I think, Frida, you mentioned it, that in the executive summary from the resolution that we just passed for Gotham, it lists 3.5% increase. However, the presentation was 3.7 increase. So let's make sure that we are consistent on that. Can we make a note and look at that resolution, even though we approve it? And I don't think anybody has any issue if it is 3.5 or 3.7. It's just to be clear and consistent.
Yes.
Is that okay, Collision?
Yes, we'll make the update on the
Okay. Okay. Thank you. I know that we are passing almost at the end. Are there any old business that we need to address? Any new business? Hearing none, and without further discussion, this meeting is adjourned. Thank you, everybody.
Thank you.
Thank you.
Members.
See you in the next meeting.
Oh, okay. You want to revisit, you want to do that?
Yeah.
This meeting is no longer being recorded.